glitch, but here we are, ready to go full steam.
Yes, yeah. What we're trying to do is test out the audio experience on Clubhouse, but we haven't had responses there, so we thought we'll bring it live to LinkedIn and across the different social media platform. Today, what we'll be discussing essentially is stress and anxiety during pregnancy. So before we do that, I will leave it to Gurjit to introduce herself and tell us a bit about who she is and what she does, and then we can get the conversation started. All
Thank
right,
you.
Gurjit, over to you.
So I'm Gurjeet Minhas, and I'm a registered nurse for like over 35 years now. And currently, I'm a professor at the university, teaching the students who are, in the bachelor's program for nursing. And I also am very, very passionate about, and I teach pregnant women how they can prepare to have a natural childbirth. And this is like really dear to my heart. So every time this topic comes up, like I'm super excited and always available. Because after having seen so many women in the hospital who have not prepared themselves, face difficulties, complications, and having to resort to drugs and C-sections, it just broke my heart. And that's the reason I'm doing what I do. Just whoever I can help, I'm so happy to be helping them. So one
Okay.
of the things I realized, as I was helping women, was that they were stressed at birth, and then I explored it a bit further, and I said, okay, in pregnancy, and they recited whole stories and whole, events that took place, and how stressed they were, and how anxious they felt all the time, and they carried that with them throughout pregnancy, and it was there even at the time of birth. And these women, I would see, struggling with the birth process. And it was really hard. And at the last minute, there was nothing I could do to help them. But let me tell you, today we are going to discuss about stress and anxiety during pregnancy and how you can actually make a difference with that. But before that, I'd like if anyone wants to share their experience or an experience with somebody who actually went through a lot of stress, then we can talk, we can take it from there and start. After that, we can start with the effects of stress and pregnancy on the woman and her baby.
Yes, yeah, that's fantastic. Thank you, Gurjit, for that introduction. Just to introduce who I am as well, I'm Jasmine Ofori. I am from Jude Digital, and what I do is I help coaches, consultants, and event hosts to stay visible online using social media marketing. So if you're thinking about your videos, infographic content, and any marketing material that speaks to your target audience, I'm here to help you to achieve that. So I'll leave my details in the comment section and feel free to reach out and chat with me. So back to you, Gurjit. Right now, nobody's joined us apart from Isume. Hi, Isume. Have you got any questions to ask Gurjit before we get this conversation started? Okay. I don't think he's yeah, he's just listening in. So Gurjit, back to you. Feel free to start and share what you would like to share about stress and anxiety.
So, talking about stress and anxiety, we all know that stress is the major cause of practically 99% of illnesses in the body. We bring upon these physical illnesses and mental imbalances just because of the stress we are in. So, chronic stress actually helps to develop these diseases in a person's body. So, think about pregnancy. In pregnancy, what happens? Stress. She's attracting situations and poor health. And not only is her poor health affecting the baby, it's also her mental state. That stress is like, in a way, baby is super, super sensitive and can telepathically, emotionally pick up all the stress that mom's going through. So any drama in her life, any crisis that's going on, And a crisis could be a death in the family, it could be her losing someone, it could be a major life event that, she didn't expect and that happened, and she's not able to cope with it. So all these experiences are actually being transferred to the little baby.
Hello, it seems like Gurjit might be experiencing some technical issues. So if you do have any questions to ask, feel free to click the link in the comment section, the StreamYard link to join in and ask any questions. We'll wait for a few minutes while Gurjit comes back.
I'm here, but
Thank
I'm
you.
frozen. Jasmine, can you hear
Oh,
me?
oh, yes, now I can hear you. Thank you, Gurjit.
But
Feel
I
free.
stopped because I found the screen frozen. That's why I stopped. I wasn't sure.
Yeah, yeah. Right now I can hear you, but the screen is still frozen. So feel free to still keep talking. It might just, come back later on.
Yes, we can do that. So,
Okay.
talking about the stress being transferred from the mom to the baby, you might say, "Oh, I don't believe that's possible." But let me tell you, I'm also a certified hypnotherapist, and it's not just my experience, but it's the experience of many people who have communicated when they regressed their clients. The hypnotherapist regressed the client, to a stage when they were in utero, and then that's then they asked what was going on with the mom at that time. And so then the person, luckily, if their moms were alive, they asked them, okay, when you were expecting me, what was going on in your life? And then the mom, shared her experience, which she might have never shared before. She shared and told her child, who of course is a grown up now, about what happened during her pregnancy and the difficulties she had and the trauma she experienced and the hard time she had. And so these things, when they're picked up by the little baby, it can transfer into issues not right at birth. Those issues can come up later on in life. So, a few things that can happen are the baby's brain development can actually get affected. So, the baby is like not super, sort of, you can say, not in the super intelligent category because the neurodevelopment is affected. Babies could have problems like ADHD, emotional issues, excessive crying, and sometimes, they're low birth weight babies. They don't even grow to their full capacity in a physical way. And they are also maybe born earlier than usual. And so when we look at all these things and we look at the effects that happen, at the time of birth, after birth, during childhood, and during, the later period in life, we understand that combating stress and anxiety during pregnancy is super, super important. So that's what I'd like to share first.
Thank you very much, Gurjit. And to echo what you said, it's absolutely true. I know I do recall during my first pregnancy, yeah, stress was sort of a part of me basically. So it did in a way affect, I could tell it affected my daughter in certain ways. And so it's very important when you're pregnant to be mindful of, your environment and also the stress that you carry around you. Yeah. Thank you for sharing and please carry on.
So, talking about this stress and anxiety and how it actually reduces the circulation to the baby, doesn't allow enough oxygen to reach the baby, and allows the baby to get more and more uncomfortable, sort of to say. So, it's the environment, right? The baby is in an environment, it cannot escape from there. It's like with the mom, whether baby likes it or not. So, whether baby is sad or happy, baby is just there experiencing the same emotions. And so it stands to reason that the stress and anxiety which is affecting the mom and the baby needs to be addressed. So I was wondering if people could, if anyone wanted to share anything they might have done during pregnancy to help with the stress.
I have shared the StreamYard link. Nobody's come up yet, Gurjit. So John Musonda is here. I don't know if he's got any questions to ask. Um, John Musonda, welcome. Have you got any questions to ask, Gurjit, about what we are currently talking about? We're talking about stress and anxiety during pregnancy. Uh, I don't think he's quite ready to speak yet, but yeah. Okay, let's carry on, Gurjit.
Yes, we will carry on. And just remind me, Jasmine, is this going to be up for replay or no?
Yes, it is going to be up for replay. So it will be
Perfect.
live on Facebook, on LinkedIn, and on YouTube.
Perfect. Because then anyone listening to this will really benefit from the techniques I'm about to share. So
Yes.
sometimes a person is stressed out because they've heard of something from someone, or they have a belief that something will happen to them, or they've heard, from sometime during growing up, and these are called timeline messages. So they might have heard someone say, oh, at the time of birth it was so awful, it was this, it was that. So when they hear all this, they start thinking about it, they start focusing on it, and then they start getting stressed. That is, one of the reasons. Another reason might be the doctor said something and they didn't clarify with the doctor at the time. But after they left the doctor's offices, they just wondered what the doctor meant. And then they just, it's almost like building a mountain out of a molehill. So when they, take what they heard and then they add their own stories to it, and then they get super stressed. That's another reason, right? They might be stressed. Sometimes there could be an illness happening, along the way. They could have, maybe, for us, it's okay. We know that it's all right, normal. But they could be pregnancy discomforts that really stress them out. And they might be wondering, what should I do? What should I do? Like, is this going to last? I just can't take it anymore. And no one is helping me. And who do I go to? And then they think, okay, we'll discuss this with our doctors or midwives. And they do go and start the topic. But at times the doctor and midwives give them some answers, but they don't have time to go in depth and clarify and really address the issue and tell them, okay, this is happening. We really think, and spend a good time with them, actually clarifying things and giving them directions. So that is the time, that's almost like a luxury with doctors nowadays. And so that's missing. So with all this going on, I really wanted to share a few things that the woman in stressful situations could do. So the first thing is, simply to sit down and start deep breathing. Even 3 to 4 breaths, very long and deep. And when you're breathing out, just simply make the sound ha. So, when I teach it to people, they start laughing because it seems so funny. Like you're breathing in and then ha. But then they try it out. Within 3 to 5 breaths, making the ha sound on the exhale, they start feeling so much better. And when they start feeling better, it's time for them to start thinking of solutions and avenues like, what could I do? And they say, okay, I think this is stressing me out. And is there someone I could ask and really find out if this is the truth or this is just my feeling? For example, I had a woman, she was really stressed out that when she would push the baby out, there would be poo, and that poo would be noticed by the doctors and nurses, and then she would be so embarrassed. And it was stressing her out, and she kept thinking, I hope I don't poo. And what if I poo? And that she just made such a big mountain of it. And when she spoke to me, I said, yeah, a little bit comes out, and that's very, very normal. And everyone knows about it, and you just wipe it and toss it out, and nobody cares. And she said, "Oh, really?" I said, "Yeah, that's nothing to be stressed out, and no one really cares. It's expected." She said, "Oh my gosh, I feel so much better now." And that stress she'd been building up was gone. So, if you can speak to someone who might be able to clarify and get you to the truth of the situation, and if it's something that's really valid and you're stressed about it, and there's something that can be done, they will say, "Yeah, so and so was stressed out with the same issue, and this is what they did, and it worked for them." So, simply speaking to someone who has experience or to your doctor and midwife and clarifying your stressful issue is the second step you can take. The first is the deep breathing to calm yourself down, because a stressful mind cannot think of solutions. So, these are the first two steps. And is I'm just putting it out again for any further questions before we go ahead.
Um, there is somebody here, but I don't know if they'd like to come up. But you are right. Yeah, if you've got a stressful mind, it's very difficult to think clearly. So yeah, you need to be relaxed. Thank you for the contributions you're making so far. Very informative for anybody out there who is pregnant and thinking about this. Platine, would you like to come up stage and ask a question? Thank you for joining us. Thank you for joining the discussion. We're discussing about stress and anxiety. Have you got any questions to ask, Platine? Um, I think he might be experiencing technical difficulties, Gurjit, so I'm going to bring him back down. But yeah, feel free to carry on with what you're saying.
Yes, sure. So sometimes it's very simple, and sometimes it depends on what the stress is, right? If suppose it's a backache that's stressing you, right? The backache is really bothering you and you feel stressed all the time. You might just decide to go and visit a chiropractor, who might make some adjustments and your back pain is relieved. Or go to a pregnancy massage therapist and they would massage your backache away, and then you feel so much better and less stressed. Then it's like, oh yeah, it's a little bit, and it really isn't bothering me. So that's another way of finding someone who can help you with the stress and seeking solutions with the appropriate person or care provider. So that is, of course, very, very important. And finally, it does depend on what the stress is, right? But I'll give you a foolproof methodology which works very, very well. So if you have a pen and paper, just write down, this method. It's like, okay, you have stress, and sometimes you say, "Guji, I don't even know what the stress is about, but I'm always in that panic mode, stressful mode, and I just don't even know what to do." So in that case, just like I mentioned earlier, take a few deep breaths and say, all the stress that I'm feeling, where is it located in my body? And then start scanning your body or start feeling your body. And suddenly what happens is that some part of the body will draw your attention. And when you look at that part of your body, it could be your arm, it could be your back, it could be your heart area, it could be your throat, head, anywhere in the body, you're going to get a different sensation. Like it could be a tightening, it could be a hardening, it could be a constriction, it could be any sort of unusual feeling. So check in your body and see where you feel that uneasy feeling. So when you have located it, for example, suppose you said all the stress, where is it located in my body? And you get a tightening in your heart. So then what you do is you simply focus on your heart and rate it. This tightening, how strong and intense is it on a scale of 0 to 10? So you're looking at it as a tightening, you're just measuring the intensity. Maybe it's super, super strong. It's like unbearable. It's like a 10. So you know that that is located in the heart area and the intensity is 10. right? So these are the basic steps you take to start the process. So once you've got this, once you've done your assessment piece, then you start with your action. So what is this action that we are talking about? This action is simply saying de-story, transform, and release. So it's simple words, and these are the words you can write down: de-story, transform, and release. And you keep focusing on the area, the heart area in this case, with the construction, and keep repeating these three words slowly. And after every repetition, you take a deep breath out, in and out. So you say de-story, transform, and release, and take a breath out. And you can repeat it 8 to 10 times. And then feel that sensation in your heart area again. Because we're taking the example of the constriction in the heart region. So after a few times, you'll notice that the intensity has gone down. Maybe it was a 10 and it came down to 5 or 4, and you feel less stressed, because when you remove it from that part of your body, it actually leaves you. That's the best part of it. And that's the magic of it. So if it can go from a 10 to a 5, obviously you're going to be less stressed. So every time you feel stressed out, steps again, locate it in your body, just see how intense it is, and start these magical 3 words. And then rate your stress again. Simple. How's that, Jasper?
That sounds like a fantastic, strategy to use to calm down when it comes to stress. I see John Musonda is backstage. I believe he might want to ask some questions. So I'm going to bring him up again to see if he's got anything to share or any contributions to add to the conversation. Hello, John.
Yes,
Welcome.
hi, John.
Hi, Jasmine.
Hi.
How are
Would you like
you?
that? I'm good, thank you very much. And yourself?
I'm very, very fine. And
Good, good.
and uh yeah.
Would you like to add anything to the conversation or ask any questions? We're talking about, stress and anxiety during pregnancy, and Gurjit has just given us a fantastic technique to use, to cope with that. She says de-story, transform, and release. What do you think about that technique?
Okay. Yeah, so I think that one is nice. And discussing stress and anxiety during pregnancy. This is one of the topics that a lot of people needs to hear, especially mothers, women, ladies, and everyone in the community, and even those who are aspiring to be fathers like some of us. Yeah, we want to learn more from the experts. So this topic is actually one of the best that, and I'm very glad to be part. So I just came in to hear from the expert. How how do you manage uh, stress? How do you manage? How can a more like someone who is pregnant, a woman who is pregnant, how do they manage stress and also be able to conflict with hormones that affects them during pregnancy? Because we all know that there are hormones that will affect them, and even the stress about maybe life. So how do you differentiate that now?
All right, Gurjit,
Yeah.
over to you.
Yeah.
Did you
Thank you
catch that?
for asking me that question. That was a beautiful question. Yes, the hormones are there, but it's the stress hormone that actually is responsible for the stress, not the hormones of pregnancy, which are estrogen, progesterone, relaxin, and the hormones that are only present during pregnancy. So that's the difference that we must realize. So if the pregnancy hormones are there, they do not cause stress in any way, shape, or form. It's the thoughts, it's the emotions, It's the surroundings, it's the situations, it's the events that cause stress.
I think John's gone back down. Oh, he's coming back now. Okay.
Yes.
Yeah.
Yeah, no,
Have you got any?
thank you. I think I've gotten the relationship between the hormones and the stress that they get during pregnancy, because sometimes they may be able to, you know, if someone is pregnant, they are affected by the hormones in the body and also the stress that comes from people around them. Even them, they have problems, but sometimes we get to conflict every problem that they bring to us. We feel it's maybe because they are pregnant, but now, even them, they are going through life just like us. So that relationship between hormones and the stress they go through, just like normal human being like us, understanding it in that way. I think they thank you very much, and I'm glad to hear it from the
Yeah.
expert herself.
And I'll
Thank
just
you, John.
answer one more thing.
Okay.
Like there are hormones in pregnancy, like the HCG hormone, which can cause a lot of nausea. Excess of it sometimes causes the woman to throw up and all, and that can be stressful. So in that way, yes, the pregnancy hormones are causing stress. But again, it's a physical issue. Same way, relaxin hormone causes the muscles and ligaments to relax. And when they are relaxed, they can be very painful, right? Because they are not as tight and toned. And so there's the relaxed, like say the joint just below the belly, the symphysis pubis joint, we call it, that can also relax and cause a lot of pain. The stretching of the ligaments at the back, all due to the
Okay,
progesterone
okay, okay,
hormone,
okay. No,
and relaxin can also cause relax and cause the pain. So, and that can be stressful. So that way, yes, I agree. But specifically, if you say that the pregnancy hormones are causing stress, no, because stress hormones are different and pregnancy hormones are different.
Okay. Thank you for that distinguished explanation. Yes. John, I hope that answered your question and that has clarified, your thoughts.
yes, yes, it has. I've seen now the relationship between hormones that causes stress hormones, and also hormones that are linked to pregnancy. I didn't know that there's a very big difference between those two. Thank you very
Yes,
much.
yes.
No
And
problem.
also the
Thank you.
woman's body is changing. She might be stressed out about the way she looks because she's not looking slim and trim now. She's got this, big belly and she thinks she's not looking attractive. That can be stressful for somebody. So, it's like all these things that are happening that can cause stress, but not a particular hormone as such. So, thank you.
Thank you, John. I'm going
Okay,
to put you
okay.
back down now. Thank you for your contribution. I think Platine wanted to come to the stage, but I don't know if he's ready yet. Platine, if you are ready, just signal, let me know that you want to come to the stage. Gurjit, while we're waiting for any more questions to come in, I just wanted to say, if somebody was watching this interview right now and they have questions, how should they contact you? What would you want to
Yes.
say to them?
Yes, thank you, Jasmine, for asking. I think, have you put the Calendly link? They can easily book time to speak to me, and we can talk about what their issues are and how I do help pregnant women. Because I do consultations where I can actually eliminate totally whatever issue they're going through, and if it's an issue like certain medical conditions, we can work on that too. But it's not like this is the only thing that will help. At times, certain medications also have to be taken in conjunction. But all the stress, anxiety, and a large part of their physical issues can be addressed in the consultation. And finally,
Yeah.
the prenatal program is like, I would say, like, it almost looks like I'm praising myself, but it's the best, I think, because we address every part of the pregnancy preparation and make sure that everything is in order The woman is totally prepared, confident, and ready, almost excited to have her childbirth. And they actually do have an amazing childbirth experience. And because they share with me afterwards, like, they are so impressed, they are so glad they did their preparation, they did all the things that are required, they spent time for themselves, they spent time for their babies, giving their babies the best, giving themselves the best, and they had good results. So, a strong recommendation to do your prenatal preparation.
Oh, thank you very much for that. We've definitely learned a few things here about stress and anxiety. So we're going to be closing out, Gurjit. If you've got any final words to say, please feel free to share before we close out.
So sometimes, pregnant women think that they have no help, no one to, they can be, uh, no one to listen to their concerns and help them. Let me tell them there is help. And I do offer support throughout pregnancy too, because certain times some women are just not coping. They have all this and they are like almost in that panic state all the time because they are so stressed out. And I just give them the support, and they are like blown away. They say they've never felt so relaxed in their lives, and they truly enjoy their pregnancy and go ahead to have a natural childbirth. So my last words are simply: prepare yourself, help is there, think of yourself as worthy to get the help, and reach out. I'm there to help.
Yeah, fantastic. Yes, Gurjit has over 30 plus of experience in this field, so she knows what she's doing and she knows what she's talking about. Feel free to reach her using the Calendly link that's scrolling across. It's calendly.com/joyous childbirth. She's on Facebook, she's on Instagram, and she is on YouTube. So be sure to follow so that you can be inspired.